sometime last year, the Department of Health issued a call for medical societies, patient organizations to simply send in the medicines that they would like to see, I think, cheaper.
Okay, made
Okay,
cheaper.
made cheaper.
Okay.
Because again, remember, we are an out-of-pocket market generally.
Yeah, meaning patients buy their own medicines. It's not like in other countries, in Europe or America or Western Hemisphere, where people are given medicines by the government, and
That's
government is the buyer.
that's right. Even in Thailand, our neighbor, whom we have often been compared to,
Yeah, Thailand is like our twin brother.
they about 91% of healthcare expenditures is actually done by government. So,
Okay.
so what we're seeing here is that, of course, naturally, when you pay for it yourself, you feel it. But if your government, or if government, which is what we are saying is the solution here, comes in, and then it becomes part of the package of health. So we're not just talking about medicine cost, but total healthcare cost. Then that becomes more affordable for
Yeah, but
everybody.
wait a minute. Let's not jump the line, as they
Sure.
say. So yeah, last year DOH called out to all of the health stakeholders, and they said, please give us your suggestions on medicines that should be reduced in terms of retail price. They gathered this, I presume. Did they show this to you guys and say, look, guys, this is what the stakeholders want. This is what they believe. They believe that the price for antibiotics or for hypertension are too high. Did they present this to you?
There was no opportunity. We did not have any kind of separate meeting. What happened was there was just a meeting called this year where all stakeholders were present, and then that's when they came out with this list. But as for us being called and to comment,
Yeah,
on
because
the
normally
submissions.
you do a survey and the survey says, okay, this is the situation. Then you being the primary partner of DOH,
Yeah.
I would have said, okay, here's the complaint of the public. What can you do about it? Was there ever a situation?
No, there was none. And that's why, as I said, the only time that we were consulted in a broad-based manner was that meeting held this year around, I think it was May or June, June, I believe, where we were one of several stakeholder groups in the room. And again, as I said, was also the first time where they actually showed the proposed list of molecules or medicines that should be placed under control. So.
So they were already presenting you their decision.
That's correct, yes.
Yeah, because they did the survey, they made the list, and that was the press release that they gave to media.
That's right.
Okay.
That's right. And that's why we've always been very consistent in requesting for a meeting with Secretary Duque and his team, which eventually took place October 21st in the DOH.
Yeah, I remember that because I remember asking Secretary Duque
Yes.
if he had sat down with the drug manufacturers, if he had read the proposal of the drug manufacturers,
Yes.
which in fact he said on air, he said he did not get a chance to read that proposal and that he had not yet sat down with you, with your group, but he was willing to.
Yes.
What happened in that meeting?
So thankfully, we were able to have our meeting that day, October 21, and that was when we met him for an hour with him, with Undersecretary Eric Domingo, with Dr. Guerrero, Melissa Guerrero, and we were also accompanied in the room by patient organizations who were there to actually see the proposal that we had. So our proposal was to say that it's five-pronged. We talked about the medicine, there would be some price reductions coupled with patient programs, which include diagnostics, screening, education on diseases, all part of the bundled package. We talked about 75% price reductions in the medicines of those who will be participating, and this would cover more disease categories, 150. Then we also talked about how we would guarantee the no expiry of medicines. As you know, the DOH has always been complaining, particularly Secretary Duque, when he first came on board, he was very much concerned about these medicines that were in the warehouses, which were already close to expiring, if not had expired.
Because it does happen, or it has
Yes.
historically happened that every year there would be news stories of medicines that have become expired
Yes.
because they were never used or issued to patients.
And I think what the problem also there is that sometimes they don't know what is in the warehouse. So our proposal is to actually ensure that that does not happen. So it's combined with the no expiry will be combined with what is called the management of the supply chain.